In my playbook tonight, I've been waiting for this one, the GOP to come up with a health care plan. Today, they say they have one. Joining me now is Congressman Nunes of California. He is a sponsor of the Patient's Choice Act. Congressman, great to have you with us tonight. Just a quick statistic here. We have got insurance companies that have risen premiums. Publicly traded insurance companies rose 428%. The profits at the 10 biggest companies, 428% from 2000 to 2007. Now, Congressman, are you going to address this tonight? Does your plan do that?
Yeah, it absolutely does. And Ed, thank you for having me on tonight to get our plan out there before the American people. We're very excited about this plan because for the first time, we have a plan that allows universal access for all Americans, and it doesn't cost the taxpayers any more money than what they're paying today. And I think that's a key part of what we're putting together here, is that all Americans will be treated equally. And I agree, the insurance companies and pharmaceutical companies have been out of control.
Well, what are you going to do to reel them in?
Our plan addresses that.
What are you going to do to reel them in?
Well, specifically what we do is by having universal access to coverage for all Americans, from the high end to the low end, everyone will have the same opportunity to buy a health care plan that will be at minimum what members of Congress have and what federal employees have.
That's the key word. They'll have an opportunity. Now, what about a public option? Is that in your offering, in your plan?
Well, when I say opportunity, it's their option. They'll have the money to do it.
Okay,
so the only thing would be if they don't want to have a plan, then they don't have to have a plan.
Will this cover the 47 million people that don't have any insurance?
It absolutely will. And I think one of the most important things that I like to say, from my district in rural California, where we have a lot of folks that are on Medicaid. So let's take the example of a single mother with 3 kids. Under our plan today, that lady would have the opportunity to have the same health care that I have. She would have about $11,000.
Yeah, but what's it going to cost? But what's it going to cost? I mean, it's connected to a tax cut and a tax credit, is it not?
It is.
Okay.
It is.
All right. So we just can't get away from that. But the fact is,
we take the dollars. We take the dollars that the government is currently using today.
Okay.
And we provide universal access for all Americans.
All right. I'm intrigued by your plan. I want to have you back on the program if you'll be kind enough to come back. We're short on this tonight, but I really want to talk more about it. Congressman Nunes, I appreciate your time.
Thank you.
All right. I give him credit. They got a plan out there. We've been asking for that for a long time.